Hi, my name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist working in UK. And I'm making this presentation for the IMG International Medical Students and International Junior Doctors who very commonly ask me that how to improve my CV. And this is one of the commonest asked questions because people are looking to move to UK as doctors and they want to know that what are the things they can do while they're in their home countries that will look impressive on the CV and will help them secure jobs in the UK. So I will share some of the tips which I have learned over the years and I've seen people doing while they were in the home countries. So just my brief introduction, I'm making this presentation in August of 2022. So I've moved in UK around 2005. So it's been 17 years. I've trained in UK as a psychiatrist and I've got CCT in 2016. I'm currently working as a consultant and I have special interest in advising IMG's doctors in understanding the different training pathways. I've got more expertise in psychiatry, but this presentation is not psychiatry specific. It is for all medical students and junior doctors. So learning objectives from this presentation is just to understand the different types of activities which can be done to improve your CV and portfolio. And I'm mindful that I'm talking about things that can be done in your home countries. For example, India, Pakistan, Bangladesh, Sri Lanka, where most doctors are coming from. And then we will talk about some of the stuff that could be done as a medical student as well, because your improvement of your CV, the process of improving your CV starts when you're a medical student, when you're an undergraduate, because once you become a doctor, there's other pressures that come on you. You might not have that much time. You might have to start a job, run a family, earn money, do some postgraduate exams. So I think it is important for us to understand if we can find time, then as a medical student is the right time to start looking at your CV and try to think about what could be done to make it more impressive. Then is one of the most important thing to talk about is that how do you evidence your progress? Because a lot of the times our international medical graduates have done things in the past which were quite impressive, but they don't have the evidence for it. And they will ask us that how can I prove it, that I have done this. So I'll talk about some of the evidence that you can use as part of your CV or part of your portfolio. So the 6 things I'm going to talk about in terms of improving your CV is the research activities, the teaching activities, some audit and quality improvement projects, teamwork, management experience, to lead some projects. Then we will talk about some of the courses and training conferences, then how can you attend them and use them as part of improving your CV and skills, and then clinical experience as well, that what is useful. So let us start with the first bit, which is research experience. Now, we all know that research experience looks very good on your CV, and research is not just about having some tick on your CV, but research also improve your understanding of particular subject. It also improve your academic writing style. It also helped you to understand what is more recently happening in a particular field. So research skills are very important for all doctors, and I think it is something that should be taught in medical schools. But unfortunately, it's not always taught in our medical schools when we are working in developing countries. And a lot of people contact me and say that I like to do research, but I can't find anybody who can help me, and I don't know where to start. So the first thing we'll address is how do I start? So first thing to do is to understand different types of research, because research is a very generic term. There are different types of researches that could be done in medical field. Then find a mentor who's actively involved in research and publication. Because if you haven't done research before, it will be very difficult for you to start from scratch. You need to find somebody who can mentor you, who's already involved, who's already doing some form of research. Then you can maybe help them become a second or third or fourth author for their first publication. And then when you get more experience and more confidence, then you can start your own activities and you can become a first author of some other project. So finding a mentor is very important. I would like to say this, when people will say now here that, I don't have anybody, my medical school is in a very remote location, or I am working in a place where nobody helps anyone. None of my seniors are showing interest. I don't know anybody who's interested in research. I think research activities are happening everywhere, and uh, it's not right to assume that developing countries researches are not happening. They are constantly happening. They are getting out and getting publications very frequently. So how do we find a mentor is important. If it's not to do with your medical school, you can always go to the big city, attend some conferences, and find somebody who is actively involved. And the way you find it as you go and look at the medical journals of your specialty, which are getting published in your home country, and then you'll find the similar names coming up over and over again, and you will know that which one of those consultants or which one of those seniors are actually doing a lot of research work. People who are actively involved in research, you'll find them done like they must have done like 50, 60, sometimes 100, 200 publications. So you would know which ones are actively involved, and then you can approach them directly, go and meet them and ask them for some time. Then research is also about aiming to improve your skills as well. So one of the things which will put off people is, if you approach a senior saying that I want to do research, I don't know anything about it, I just want it to look good on my CV. That might not look very good in front of your senior, and they might not be that willing to help you if they hear a response like that. So when you approach them, you need to be showing some enthusiasm. You need to first done some kind of research yourself, that what is their special interest, what kind of projects they have done in the past, what are they actively involved, and then offer your services, offer your help. So for example, if you're approaching a senior, you can say to them that I'm really interested in research. I have seen your previous works, and I know what is your area of expertise. I know I've also been reading about the projects you are currently involved in. I've spoken to the trainees you have helped in the past, and would you mind including me in one of your projects? And I'll be happy to give my time, and whatever you say, I'll follow your direction. Those kind of things, when they would know that you are there to actually learn and help them and improve your skills, they will be probably more willing to help you. And this is also a wrong impression that people don't help others, because people who are actively involved in research, they are also actively looking for people who are serious about helping them, because that's also from their end, it is also difficult to find somebody who can help them. So this is important to understand when I say the research, different types of research. This is just an example, a very simple example of hierarchy of research which is available. So if you start from the bottom of this pyramid, animal studies, laboratory studies, we don't get involved in that usually. What we can involve ourselves in as a junior doctor or a medical school student are the case reports and case series. Case reports are very simple. If you see an interesting case on a ward or under supervision of a consultant, you can actually write that. And if the consultant is involved in particular expertise and they have series of interesting cases of the same condition, then you can write a case series. Case series could be 3 cases or more. And then those case series and case report can be published in the journals, and then they can also go to the conferences. They can also become case presentations which you can give to your department. So this is a very good time, or good I would say level to start. And this is something, if you find the British medical students are started doing by 3rd or 4th year of their medical school usually. Above that, you will find the studies, case control studies, cohort studies, randomized control trials. And these studies are possible, but they are a bit more difficult to do. I'm not saying they're impossible, but these studies are normally done by multi-centered approach. They are done by funding. They need ethical approvals as well, especially if you are involving active interventions. So you can join them. You can find them, find out where these studies are happening around you. And they are happening in big centers, in university hospitals, and you can join them. But it is not expected of a medical student or a junior doctor to be starting their own randomized controlled trial, because that is something above, much above their level. Above that, you'll find the meta-analysis and systematic reviews, and these are important aspects, because meta-analysis can take some time, but systematic review is actually not that difficult to do. That is something you can again learn yourself. You can read some of the systematic reviews and how they were done. Then if you have a mentor who can actually help you find a subject that you can do a systematic review on, and they don't require active patient involvement. They require a good ability to search for articles and then analyze them, then write them, so that they could be done while you are sitting in different cities. Your mentor is in a different city. You don't have to actively be with them or actively be doing intervention on the patients or getting information from the patient. They can be systematic reviews, could be of research which has already been published. So I will now show you, when I mentioned case reports, I'll show you something which I find interesting. If you go to Google and search for BMJ case reports, you will find that BMJ case report has a journal as well. And if you can open that, then you can find here that instruction for authors. So, people will say that, how will I write a case report? I got an interesting case. You can simply read the instructions. They are very simple, and you can follow them, and it will become a case report. And then you can, if you like to submit it to BMJ case report, you can do that. Otherwise, in your own area, in your own local country, you will find journals will be accepting case reports as well. If you like to read some case reports, then again, BMJ case reports is a very good areas, and you can case report by specialty. You can look out for, if you are interested, for example, in radiology, you can read radiology case reports there, dermatology, psychiatry, anything. So that is, I think, a good starting point, because once you first read case reports, then you will see you are seeing similarly interesting cases that you can write in the similar way. And that's how you will initially develop some confidence. So this is highly recommended for medical students. I always ask them to read this and try and find interesting cases and try and write an interesting case report and then submit it. Even if your case report is not accepted by a journal, they will give you feedback which will be useful for your future case reports. So in the hierarchy, I haven't included there are something called the qualitative and quantitative research as well, which are again very much doable at the medical student level and also level of a junior doctor. They, for example, include sending out some surveys. Surveys could be for patients, their carers. Surveys can also be on doctors and medical students themselves. You can do that. Qualitative research will include interviewing either carers, their patients, or other doctors on educational research, and that can also be published and has good standing on your CV. So how do you evidence your research? So if you have been involved in research or being part of a big project, make sure that you gather some evidence for your CV, because that might be required when you're applying for training jobs or non-training jobs in UK. If you have a publication, that's very good, because then anybody can search your name and then they can find it, and then you can put that publication in your portfolio. Publications are best. Publications are the ones who are published in the peer-reviewed journal, which are PubMed index journals. So there are some journals which are not on the PubMed index, which are, we could say, that low impact journals. So for example, if you're from Pakistan, you might find only a few journals of Pakistan are actually in PubMed index. Most of them are not. So still, those, if you publish in those journals who are not in the index, they will still have some standing. It will still look good on your CV, but your aim really should be to get the publications in the PubMed index journals. The other thing you can do with research is to create some posters and presentation at conferences. So all the big conferences that are happening, every specialty will have annual conferences in your home countries. They will always ask for posters, poster presentations, and ask sometimes for juniors to do some oral presentations as well. And you can submit your ideas there. And if you are given a slot, that will be great. If you haven't done a poster in the past, you can always look out for some poster that has been published on internet. you will find a lot of examples, and then you can sort of learn from them how to write a poster. This poster is mostly your abstract and some diagrams that can showcase, that can help to showcase your project. Abstract of your research is also important. Sometimes, when we are doing a presentation in front of a panel, interview presentation, or if somebody is checking your portfolio, it is good to have that abstract attached in your portfolio, and not more than an A4 sheet. That will help to evidence as well that you have been involved in research. But it is important, if your name has not been published in the research paper, that means that you need some more evidence, like a letter from a senior confirming your participation in the research. What were you exactly doing? How much were you involved? That will also help as well, and that will also count as an evidence that you have actively participated in research, you understand the principles of research, and you have been part of a project. Now, the second one is, we'll talk about teaching experience. Teaching experience is something that the UK NHS value a lot, and you will see when you're filling up a form for applying for a job in UK, they will ask for if you have any experience to teach. The reason teaching experience is important is not just about teaching medical students. Teaching is not just for people who are teaching medical students or in medical colleges. Teaching is about the way you communicate, the way you can understand illness and explain that in a simple word. Sometimes that experience is also useful when you are talking to patients and their relative about their condition. Teaching also improve your communication skills. Teaching also improve your team working skills as well. It also improve your confidence, and if you teach a topic which is more recent, that also improve your clinical knowledge as well. So coming to teaching experience, people will ask us what could they do to gain teaching experience. So there's something very obvious that you can teach the medical students. If you are a more senior medical student, you can teach the junior medical students. If you're a junior doctor that attached to medical college, then you can do the medical student to teach medical students as well. But then teaching needs to go beyond medical students. There are some general public health awareness campaigns that you can become part of. You can start your own general public health awareness campaign as well. It could be online, it could be in person. Bedside teaching is an example. Giving lectures in different setting, setting up a series of lectures as well, if you are interested in one particular topic, and arranging some workshops. So they are all part of teaching experience. The important thing to notice is it's not just in the medical arena. General public can also be involved. Nursing staff can also be involved in your audience. So teaching experience, people will ask us, how can we evidence the teaching experience? A certificate confirming that you have been involved in teaching, a letter from a senior or your department confirming your teaching activities. Feedback from the students will be also useful, and this is something which we do a lot in UK. We are encouraged to collect feedback from our students, and then that feedback help us to reflect on how the teaching session went and how can we improve it for the next time. Then you can write a reflection on teaching as well. Now, reflection on teaching is quite simple. What were you going to teach? Simple 3 paragraphs. What were you going to teach? How did the teaching session went? And what was the feedback like, and how can you improve it for the next time? So don't need to complicate it too much. Simple reflections can help to improve your future teaching sessions. If you are gathering evidence for teaching, and if a senior is writing you some evidence, just having a certificate that you taught medical students is not enough. I think if you need to write it a bit more depth in that, like things like the number of students and their level. So you can say like 30 medical students and it was 20 in number. Set up the session was the bedside lectures, bedside teaching, lecture hall, workshop. Was just a single lecture of a series of lecture topic, what you were going to teach, length of presentation, 45 minutes presentation, whatever it is, learning objectives and outcomes. So if you document that in like a A4 size a confirmation letter from your senior that can help to showcase that you have done that. Like, I'll go back to the slide here. So teaching, people would ask us to give some examples of what could be done in that arena. Um, I can give you some examples from the mental health part. We have junior doctors who have been involved in charity organization and charity work back home. So, for example, I know Pakistani junior doctors who were going to different settings like schools, they were going to mosques, they were going to community centers and speaking to the general public about mental health and giving them lectures around basic stuff around what is depression and how to identify depression, how to treat it, what is anxiety, what is psychosis, how to manage self-harm thoughts, on all of that. So yeah, that can become a series of lecture which you have given to general public in different settings. Get that evidence right in writing, because that will actually help you in improving your CV and showing that you have been interested in that sort of activity. Now I'll show you here another thing, which is a form, teaching feedback form. People were asked, we generally, I understand that in developing countries, it's not a routine thing to do to collect the feedback from the students, but it is something which we do a lot in UK. So you can collect teaching feedback. Simply go to internet and type teaching feedback form, and you will come to this website, evaluation of teaching and presentation. This, if you open this website, this is from the Joint Royal Colleges of Physicians. It's a very simple form. You can open that and you can see this form is quite simple, and ask your students about how you did. You can modify this form as well, because it's in the Word document, and put your own name on it and the titles and stuff like that, and then distribute it to your student at that end of a teaching session, asking them for their feedback. Gather that, and then you can write a report on it, that how it went, what was the feedback, what did you learn from it, and how will you do it differently the next time. Another way of showing your interest in teaching is to attend some teaching courses. Now these courses may not be free. I think it's important that if you are spending money, that you need to know that if they will be useful or not, or if you are really interested, or if you're just doing it to improve your CV, because these courses can cost a lot of money. There's a very famous course in UK called Teach the Teacher course, which is done in different places in UK. So it's a very good course, and if you really are interested in teaching, you should attend that, but it can cost you money. Effective teaching skill course, which is done in Cardiff as well, that can be by Cardiff University. That could be one of them as well. Again, they're not free. Sometimes teaching qualifications are formal, like postgraduate certificate in medical education, postgraduate diploma in education, masters in medical education. These are university qualifications and done via different universities in UK. Now I understand that even in Pakistan, there are some formal qualifications done in medical education, in education in general, and they will all help to improve your CV. But again, if you are signing up for one of those courses, you need to understand that it takes time to do them. It will take effort as well, and they will be costly as well. So if you are investing your time and money, you need to be sure that this will really be useful for you, or if you are really interested. So I'm not saying everybody should sign up for these courses. I'm just giving you an example that this is the next level. If you want to teach in the future, these are the things you can do to improve your CV. So next thing I will talk about is the audit and service improvement projects. Now again, people contact me and say that they want to do an audit. They've heard something called audit happens in UK, but they will say to me that nobody does audit in my country. I don't know where to start from. I don't know what audit is, and I have no idea how to go about it. So first thing to understand, about audit is that service improvement projects or activities are happening all around the world. Even in your own country, service improvement activities must be happening. They might not call it audit, they might call it something else, but everybody who's working for a health service at some level, from managers to the consultants to the doctors working there, are actually looking at ways to improve it. So they will always bring in new initiatives to improve the service. And that is basically the quality improvement project. And to do it formally is called an audit. So basically you are comparing, so the question here is, what is an audit actually? Just a little introduction to that. Comparing your current practice with some set standards. That is the simplest definition. The aim is to improve the quality of care, and it can certainly be done outside UK. If it doesn't happen in your country, you can set one up yourself, because simple audits are not that difficult to do at all. They are not like research. They don't usually require ethical approvals and things like that. They can be very, very simple and can be done within finished within like a few days, a few weeks. So where do I start? This is something common question people will ask me. I want to do an audit which will look good on my CV, but where do I start? Generally speaking, we start by finding a problem, which is in a clinical setting or a service, a hospital service. Discuss it with senior that this is something you have noticed and you want to improve that. Find the expected standards. That could be set standards, national standards, or local standards. Then find what is actually happening and compare it with the current practice, and compare it with the set standards, and then that will give you the initial audit. So I will give you very, very simple examples. I mean, audit could be done in multiple levels, national audits to a very simple ward audit. Very simple example I'll give you here, which I've seen people doing in Pakistan. So they say when a new patient comes to the ward, admitted on the medical ward, they need to have a basic history of presenting complaint, past medical history, their list of their medication, then an examination, basic examination of all the system, then differential diagnosis, and then a treatment plan. So this is a very basic thing that should happen when a patient comes to a medical ward. But those, you can say that you can find out the problem is that when the junior doctor is admitting those patients, those things are not all happening. Sometimes the examination is not complete. Sometimes the history is not fully taken from the patient or the relatives. Sometimes the differential diagnosis is not very clear. Sometimes the management plan is not very clear. So you can say, for example, take up a sample of 20 patients, 30 patients who were admitted in the last week or so on a ward or a month, and then start comparing that what are the set standards, what should really happen. So these are the steps that should happen when the patient is admitted. This must be documented initially, but only, like, say for example, 50% or 30% or 80% of patients notes are actually meeting those standards. And that will give you a basic audit of what could be, what was expected and how we practicing. Then how can we improve it? The students I was working with, what they did, but they came up with a performa. They said, we will make an A4 form, very simple, two-sided A4 form, which will have all the information which is required to be filled when a patient is getting admitted. So history of presenting complaint, as I said, past medical history, list of medication, examination findings, differential diagnosis, and the plan. So when a junior doctor is actually admitting, they fill that form, so they have the prompt of what they should be doing and how can they complete it. And then they did the re-audit and they found out the quality has improved of the first initial clerking. This is just an example of what could really be done in an audit. So this is just an example, a visual example of what is an audit cycle. Starting from this yellow bit, the set standards, find out the set standard, what is expected and how the service is working, measure the current practice against those set standards, compare them, reflect and plan change to see if things are not happening correctly, what can we do to change it. And then you re-audit it again after you have implemented those changes to see if anything has improved or not. So this completes an audit cycle, and you can say that this is a quality improvement activity which you have included and done. This is important because when you will fill a CREST form is basically foundation competencies. They will ask you if you've been involved in an audit cycle or a audit or a quality improvement activity. Now I will show you some of the, I have written a blog on this as well, so I'll show you that. These are, if you go and search in audits in psychiatry, it will come the first, usually, hopefully the first hit would be my website. You can go on this website. And it will open up a blog which I've written, which is about audits and quality improvement projects in psychiatry. And this is around 40 examples of audits that have been done. Talk about the audit cycle here, how to generate an idea, find out the guidelines, different guidelines. And then there are several examples of ward audits that have been done on the ward setting, of the ward round, audits on the medication charts, and a lot of different examples of different settings. Some of these, I mean, I would say most of them are actually done in UK, but they were some simple ones, so that can be replicated. Even if you are not working in psychiatry, some of these things you can find the ideas of how this could be done on, for example, in the medical ward or surgical ward. So again, we'll come to this idea of how do we evidence an audit if you've done one. So you can write an audit report. Audit reports are very simple stuff, that what was your aim and what was the methods you used. So you start from aim, background, methods, and analysis, and the conclusion. So that on an A4 side, like an abstract, you can finish a report which will show that. And then sometimes you can get also a certificate confirming your participation, especially if you're working in UK. Try and get a certificate, because that will look very good on your CV. Or if you're outside UK, you can ask your department to give you a certificate. Audits can also be presented in conferences as posters, especially the UK based conferences will accept audits as well. So that will also give you a forum to discuss your audit, and also it will give you a certificate as well that you have been to a national conference. Now, the fourth thing which we'll discuss about is the team working, leadership, and management experience. Now, this is something I think that is already happening in the developing countries. The medical students and the junior doctors are already involved in these activities, but we don't know how to identify them, how to evidence them. So I'll give you some examples here. So some practical examples are here. Setting up a project to help patients and their relatives. So that will give you a team working environment as well, that you were, if you were managing that project, that will give you that experience as well. Working together with your colleagues on a research or a quality improvement projects like an audit as a group of medical students and junior doctors, that is a team working experience as well. Again, setting up health information initiative for general public, like I was giving you an example earlier, that I know in psychiatry doctors who have been setting up different initiatives to teach common mental illnesses to in different settings. For example, they are teaching police officers or policemen about common mental illnesses and what to expect if you see somebody who is going through an acute mental health crisis. Going to school and in secondary school and teaching kids about common mental illnesses and what are the signs that should be they should be aware of. Teaching general public in other forums as well about different health conditions. That could be an initiative that you can claim as activity that you led, that you manage and work as a team on. Participating in vaccination drives. When I was a medical student, we used to have polio vaccination drives, and we were part of that, and we will go to different schools and different villages and give polio vaccinations, and that was something we did as a medical student. Gathering donation and distributing them, whenever there's a crisis, a flood or earthquake, things like that, doctors are always on the forefront and doing those activities. Arranging blood donation, blood banks, working for blood bank. This is something, again, we did a lot during our medical school. We used to go to different areas, convince people to come and to donate blood. There were a lot of myths around giving blood, that, it will make you weak and all that. So we used to try and address those myths and try and convince that people that their blood donations are very important, because in hospitals there are many people who die because of lack of blood, and get like 20-30 people convinced, ask them to come and give blood. Those kind of things, then you can that will give you also team working experience, management experience to lead the project. Working with different charity organizations, I think this is something which is happening now quite often. Different charity organizations target different individuals or different group of individuals. If it's a mental health charity, they will be more expert in mental health issues. Working with them in different capacity, health awareness campaigns and things like that, that can also be helpful. Sporting activities is a very good thing, so that is although not very, it's a non-clinical activity, but it does show that you have been involved in team working and can manage things and can lead things as well. Then arranging teaching and conferences, as I mentioned earlier, attending the conferences, arranging the conferences, arranging the organizers in the conference. So usually the conferences are arranged by your senior, the consultants, and more senior doctors will be involved, but you can become part of that management committee, and that can also give you some experience as well. How do you evidences? You get a certificate confirming your participation from your seniors. That is something that you can put in your portfolio and keep as an evidence. Letter of recommendation from your seniors, again confirming your role in these activities. But if you are doing that, then evidence exactly what you were doing. Just saying that Dr. So-and-so helped us in arrange a conference may not be enough. It might have to be that Dr. So-and-so helped to arrange a conference. He was actively involved in advertising the conference. He was actively involved in recruiting the participants who were going to participate in the conference. He helped to arrange the venue and manage the conference on the day, and welcoming the guests, directing the speakers, making sure that they're running smoothly. That kind of thing, that you know a bit more information of how much you have been involved in that particular activity. Leadership is an example or a quality, you can say, leadership quality they will always look for in doctors. And and if you look at any recruitment drive in NHS for doctors, non-training jobs or training jobs, they will also always ask for the qualities that you have as to lead. So what are these qualities they're looking for, that and how does it help you in becoming a better doctor? You need to understand this. The ability to lead can be clinical or non-clinical. Because whatever your skills are, even if they are in a non-clinical area, they can always translate into a clinical area as well. So that quality they look for, that you are able to take initiative, you can drive change, you can inspire people, you can encourage people, you can develop networks, and then you can build and maintain relationships as well. And these are the quality of a good person who can lead. And communication skills is a very important element of that as well. So these are the qualities you develop when you try and lead a project, or you take command of a project. And that is something that you can evidence as well, and that will help you improve your CV as well. So next one I will talk about is, in terms of improving your CV, is courses, conferences, training activities that you can do while you were in your home country. So obviously everybody will do the MBBS, everybody will do the internship, but you need to think that how can I improve my skills over and above a normal medical student or an average doctor? What courses I can do which can show my interest in that particular specialty. So if you are particularly interested in, for example, surgery, doing a basic surgical skill course may be helpful. If you are interested in anesthesia, maybe management of airways may be a good thing. If you are interested in medicine, advanced life support, if you're interested in psychiatry, there are several psychiatry related courses, learning about different psychotherapies, management of psychiatric emergencies, those kind of things. Say courses and trainings could be could be specific to one specialty, they could be more generic. Say conferences are again usually more specific to particular specialty. The advantage since COVID has been that people now can attend online things as well. So you can attend the international conference while you are sitting in your home. You can attend a course internationally as well, and while you're sitting at home. Sometimes you can also find free courses, free online learning, which will also give you certificates as well that can help to improve your CV. As I said, attend the ones relevant to your specialty, because sometimes you have to show your interest in that particular specialty. So example, if somebody likes to apply in psychiatry and they might not have massive amount of experience in psychiatry, but when they are going for interview, and the person who is trying to recruit them or interview them, they might look for evidence that this person has been interested in psychiatry and has shown some commitment to the specialty. So if you haven't worked in psychiatry post, that's fine. Everybody has to start from somewhere. But if you have shown them some courses you have attended, some online learning you have done, that will show them that you have been interested and you've been trying to improve your knowledge. Attendance certificate will be a good part of evidence. Then reflecting on what you learned, I think that is I'm bringing reflection again and again. I think it's important to say that reflection isn't something that is valued in UK a lot. Writing reflection on a course or conference, I think is very simple. Simple as that you can write it in basically 3 paragraphs. In the first paragraph, you can say, I was going to attend advanced life support, for example, course, and this is how much I knew about it. I knew basic life support, but I haven't known that much about advanced life support, although I have seen videos and I have read about it, but I didn't have that much practical experience. And when I attended the course, the second paragraph, so what you learned, and the third paragraph would be that how would you apply that knowledge to your clinical practice, and how will this improve you as a doctor? So these 3 things: what you knew prior to attending the course or conference, what you learned, and how will you apply that knowledge. That is a reflective note, which could be simple 3 paragraph on a A4 size thing, that can go in your portfolio as well. Now, in terms of courses, training, and conferences, as I said earlier, that there are clinical courses, like, as I give an example, advanced life support. Then there are some educational courses as well, which we already mentioned, that if you like to teach, then educate the courses that can improve your education skills. Then there are some management and courses as well, which improve your that sort of skill, which are non-clinical management and ability to lead, those kind of skills as well. So these courses are available online. But if you are, I would say, if you are from a developing countries, if you have to spend money on it, you need to be careful that it is the right course for you. It is really going to help you improve yourself. Don't waste money. I'm trying to say that quite often you can find a lot of these things for free as well, with certificates and everything. And I'll give you some example here. I'll show you what Royal College of Psychiatrists is doing. So if you go to Google and put Royal College events, Royal College of Psychiatry events, or IRC Psych events, and then it will bring you to this page, and then it will have events. You can see here conferences, training events, certified courses, in-house courses, and then they have some free webinars as well. So these webinars you can attend, the series of webinars, upcoming webinars, which will also give you certificates as well, understanding on mental health illnesses. Courses and events, if you go on that, it will tell you which are the upcoming conferences, and sometimes these conferences are still happening online, that you can attend. Sometimes they are for free as well. Some of these will be paid. And if you go to Google and put RC Psych CPD online, free. So you can they'll bring it to you to this page, which is the e-learning hub for RC Psych. And they have a lot of CPD active. CPD is continuous professional development. This might be called CME in some areas, some other areas of the world. So it will have a lot of modules. You can see different modules in psychiatry. If you go to CPD learning free content, you will see these are the free modules. You can learn from I think quite a lot. They used to only be 8. Now they have developed them more. So these are not just free, and they're online as well, and also they will give you certificates as well. So I'm just giving you example from Royal College of Psychiatrists because I'm particularly linked with them. But there are other Royal Colleges who always have their events pages, Royal College of Surgeons, Royal College of Physicians, Royal College of Obs and Gynae. They'll all have their e-learning pages, and then you can find events from there and courses on them as well. Other than Royal College, there are other places you can find courses as well. And about conferences, I just wanted to say to the junior doctors, see, there are different ways of attending a conference, and you need to develop your confidence. You should start attending conferences. Ideally, you will see here medical students are coming from third year onwards to conferences. Initially, you attend a conference starting from the bottom, attend as a participant. So you're just a participant there. You just booked a conference, you went there and just look around. It's good for networking, it's good for learning. Then second thing you can do once you get a bit more confidence is participate in arranging the conference. So you need to contact the supervisors or the people who are actually arranging that particular event and see if you can be of any help. That will give you the experience, not just that you will get to attend the conference, but now you are actually part of the management committee, and then will give you experience of managing events. And that is a very useful skill to learn when you are young. Then you can also attend conferences while you are doing a poster presentation or a small project. So all conferences, I would say most conferences, the national level conferences as well, they will always have spaces, events or time for the junior doctor to do their presentation. That might be a poster presentation, which is very common in UK. Most of the Royal College conferences are asking for posters. But sometimes there is small talk you can also give. They might give you a 15-minute slot to say that if you have done a project, if you've done a research project, audit, or any project to improve the quality of your service, you can come there and talk for 10 minutes, 5 minutes, 15 minutes, and that will give you a certificate as well, and that will give you a good understanding of how things work. Then arranging a workshop, when you have more experience, then you can be at a level where you can actually arrange a workshop. So when you contact the conference managers, you can say to them that I understand you're arranging a conference in March, for example. I like to see if we can give me some slot to arrange a workshop. I have an idea. I've got some seniors with me which I can bring on board. So you can give us 45 minutes, an hour, and whatever they have the time slots for. Arrange that workshop, and that will show you that your ability to lead, your ability to manage, your ability to do teamwork. Then again, get a certificate from them. So the reason I mentioned conferences, people when they hear the word conference, they just think this is like a social event where they go and eat and maybe see some stalls. But there's actually much more that goes on in a conference, and that activity of attending a conference can help to improve your CV in a lot of different ways. Now we'll talk about clinical experience, and I left it to the last, but when you're filling a form, clinical experience is usually at the top. But I think it's important to understand how do you develop clinical experience, which we all do, obviously, and sometimes the evidence is very obvious. If you are working with the supervisor, you can get a supervisor report, they can become your reference. That is one thing. House of certificate, internship certificate is evidence of clinical experience as well. If you are doing any observership, any electives as a medical student, that can be a certificate as well. If you've come to UK and for PLAB 2 and arrange a clinical attachment, getting something in writing that you've done a clinical attachment, that will also be clinical experience and exposure. So with clinical experience, the most important thing I wanted to say to the junior doctors working, IMGs, working in the home countries, medical students as well, that it is important to try and work on this CREST form early on in your life or in your career. So basically just download the CREST form, which is certificate of readiness to enter specialty training. A lot of people say, what is actually a CREST form? Why is it important? What is it? CREST form is basically a certificate, you can call it a house jobs equivalent certificate, which you need to have to enter training in UK. You can enter a non-training post, junior post without a CREST form. That's not really required for that, but for a training program, it is usually required. Sometimes now the non-training post, they start asking for it as well. So it's important to download CREST, just because you can then see what are the competencies they're looking for in their house officer or their foundation doctor by the time they finish their foundation training. So in UK, the internship is called foundation training, and the doctors there do it for 24 months, for 2 years. And this CREST form actually simplifies and tell you that what are the skills a doctor need to have by the end of those 2 years. So then you can start doing those things if they're not happening in your house job or wherever you're working. Find those opportunities, do them, gather that evidence. So when you're ready to get the CREST form signed, you have the evidence ready to show to your senior. So let me just show you the CREST form. If you know, it's very easy to find. You can go to this website called the Specialty Training. If you search CREST form 2021, I mean, I'm making this presentation in August of 2022. So the latest CREST form is 2021, but by the time you see watching this presentation, the CREST form may have been updated, because they sometimes bring a new form. But this is the CREST form. You will see the first hit would be the CREST form, the Certificate of Readiness of Specialty Training 2021, and it will all have initially your name and everything, and then it will be talking about all these professional standards, that what should a doctor be known to be doing to be competent at a foundation level. Some of them are quite generic stuff, professional behavior, personal responsibility, patient-centered care, trust, consent. These are general values or general skills that doctor develop. But then there's sometimes very effective or specific things like communication skills. They will talk about ability to lead. As I said, this is important, that your senior can take that you have been involved in some activities. Then this is the more critical care bit, which you need to see if you can develop those skills: recognition of acute illness, assessing an acutely unwell patient, immediate management of acutely unwell patient, a management of a frail patient, nutrition, history taking, physical and mental state examination, diagnosis, clinical management, clinical review, discharge planning, investigation. All of these skills are something that they're expected to a junior doctor at a level of foundation by the time they're finishing their foundation training. Then you can see here the cardiorespiratory arrest training. They expect you to have some knowledge on that. Do not resuscitate orders. That's another important thing. You need to read about them and see. You can learn them in your home country. Attend some courses around that. End of life care. People say to me that that doesn't happen in their home country. And maybe sometimes they are palliative care teams. People do die in hospital, and they do require end of life care. Infection control, how the principles of infection control. So there are a lot of these are the list of competencies they're expecting you to develop. So as I said, download this CREST form early on, even when you are going for your PLAB exams or you're a medical student, and see what are the skills required in UK to become a doctor and work at a foundation level, and try and gain those competencies, try and gain their evidence, because that will eventually be required at some point. But if you are more specialist and more senior, so if you have been already started training in your home country, so example, if you are a resident doing FCPS in Pakistan on psychiatry or medicine or surgery, then you are above the CREST level. But then there is something else. There is something called core competencies. So in UK, the training they were usually divided into 2 different levels. Like I give you an example of psychiatry. Psychiatry training is not one length. You first do core training most of the times, then you do MRC Psych during the core training, and then you go to ST training. So in surgery, you will do the core surgical training, then you will do your MRCS, and then you will go and apply for the ST training. Same as in medicine as well, you do IMT, and then you apply for the ST training after that. So now those competencies which is required for core competencies in the initial 2 or 3 years of training as a junior doctor, they also have their forms as well. So if you are already doing training in your home country, like for example, if you're training in medicine, in surgery, psychiatry, you can download those different core competency forms and see what is required. So let me show you the example of this. So this is a certificate C for CMT, the competency ST3 recruitment form. You will find it on the website. And this will again have the initial details, and then it will take you through the different domains that they're expecting for a medical trainee for the first 2 years or 3 years they have done. They should know all of these things. So for example, if I go to psychiatry, actually if we go back to this, and this is a website, a resource bank or special training. If you go into that, then you will find very useful documents there. And here you will also find this certificate of readiness to enter higher surgical training. So this is where you say that you have done surgical training, basic surgical training in your home country, and you want to apply for surgical ST training. You've done MRCS. So this is the form they will be expecting you to fill. So it's good to have sort of an idea of what are they asking for, what are the core skills they are expecting you to develop as a clinician. And then try and develop those skills while you are training in your home country, try and evidence them, and then get this form signed, and then you'll be able to ready for, say, sort of basic surgical skills. For example, they're mentioning here that these are the ones you need to know and the basic surgical training. So these were just examples of what clinical experience will be useful when people ask us, so I think it's good to link up with what is actually happening in UK, what are the UK trainees doing, what is expected in UK, and then look at yourself of how can you gain that experience while you're in your home country, while you're waiting for the UK exams, and then evidence it with different certificates, supervisor's report, those sort of things. Again, evidence your progress in clinical arena. I think there's something called logbooks which are used in surgery quite often. That could be electronic logbooks, could be paper logbooks of the activities you've done, getting it signed off by your seniors. You can go online and find the free logbooks templates. Supervisor reports are very important, as your supervisors are signing you off and saying that you're competent in that particular level. The forms I've showed you, the certificate C, the core competency form, the CREST forms are usually signed by the consultants who you work under. Workplace-based assessment, I've written that is something is used in UK, and our trainees do that starting from the foundation, from the internship level all the way to their higher specialist training, that they do some workplace-based assessment with their seniors, and that is an evidence that they are learning and they're improving, they're getting feedback on their performance. You might not be able to find these in your home countries, but I think it's important. You can try and find an example of that online, and then see if you can adopt that to your particular workplace, and then your senior can actually give you more feedback or more evidence based on those forms, and that can be used in the future as well to improve your CV. Reflections, again, I've brought them back here. Again, reflections are important to write. If you haven't written them, there are examples you can find online on my blog as well of reflective practice. It's quite simple for a clinical case that reflection is not about that you've made a mistake, and a lot of people think I can only reflect if I made a mistake. It's not about that. Anytime you're learning a new thing or you finding something new, you can write a reflective note that you saw a complex case, you knew this much about that condition, and after that you found out some new information, and that patient interaction taught you something more, and you did some extra reading. And next time when you see a similar case, what will be your approach? That's all, that kind of simple reflection. So that's the end of the presentation. I hope it was useful, quite a lot of information, but these are some useful links just about my contact details. The first one is psychiatrytraining.com it's a blog, it's turned blog or website. It has a lot of articles around things like how to write reflections and audits and things like that. Then my Twitter handle, and there's a YouTube channel as well, and this hopefully video will be uploaded to the YouTube channel, and then have an Instagram account. And this is the if you are interested in psychiatry, we have a psychiatry training group as well. You can go on online and search on the Facebook, and you'll come to that group. Join that. There's a lot of helpful people around that. And then thank you very much for listening to me, and best wishes in terms of improving your portfolio and profile. And I hope whoever is aiming to come to UK hope to see you here soon.